and we're going to deviate from my usual favorite topic of conversation, the pandemic, into a subject that does not get enough attention, and that is organ harvesting and brain death. If you are watching this live, please share and spread the word so we can get more people watching. Dr. Klessig is a trained anesthesiologist and pain medicine specialist, and some personal experiences early in her career prompted her to question the whole concept of brain death. So, Dr. Klessig, why don't we start with that early experience I've heard you describe before? I thought it was very impactful about the patient that made you start questioning this whole practice.
Sure. Thanks so much for having me on the program. This came to me as a bit of a surprise, as I think it often does to people who are suddenly confronted with an unforeseen medical emergency and have to make decisions sort of on the fly. And that's sort of what happened to me. I came in to take night call one night during my anesthesiology residency program. And after reporting for duty, I was told to go up to ICU and bring down a brain dead man for organ harvesting. And, honestly, it caught me kind of flat footed. I was sure I had heard somewhere along the line a lecture about brain death, but I didn't have all the facts right at hand. So I asked the doctor at the desk, I said, "Oh, brain death. Is there anything different about this case I should know?" And, he laughed and he rolled his eyes and he said, "Just be sure someone has actually declared him brain dead. You know how eager the transplant team can be." Not what I wanted to hear. So I took a big deep breath and went up to ICU. I found my patient. He was a young man about my own age at the time. He had been in a severe motorcycle accident. He had a traumatic head injury. And yes, indeed, the neurologist had seen him and gone through the brain death protocol and had checked all those boxes. So the man had been declared brain dead. But when I went to look at my patient, he didn't look dead. He was warm. He was pink. He was moving at times. He had good blood pressure, good heart rate, nearly 100% oxygen saturation in his blood. I mean, honestly, he looked just like every other ICU patient I'd cared for. And in a lot of ways, he looked better than most. He wasn't on much for drugs, drips, or infusions. So I took this information back down to the operating room and I found the staff anesthesiologist who was going to be supervising me for this case. And I presented these facts to him and he said, "Okay, what's your anesthetic plan of care?" And honestly,